Hello, my name is Andres Luque. I'm gonna talking about hyperkalemia after mice hemodialysis. Definition: Hyperkalemia. What is hyperkalemia? Is an elevated level of potassium in the blood. Normal potassium levels are between 3.5 and 5 mol. Hyperkalemia can cause an abnormal heart rhythm, which can result in cardiac arrest and death.
We have 1 critical minute to focus on the ECG changes in hyperkalemia. Let's go. The first changes that occur as potassium levels rise are the peaking of T waves. Next, the amplitude of the P wave decreases and the PQ interval increases. The QRS widens severely. As potassium increases further, the shape of the QRS segment and the T wave become more sine-like. This is highly associated with ventricular fibrillation and with that cardiac arrest. If you have a patient with hyperkalemia that has a wide QRS segment, keep them on the monitor at all times. For more information on hyperkalemia, including treatment, watch my video on it. You are dismissed.
Hemodialysis. What is hemodialysis? Is a treatment to filter waste and water from your blood, as your kidneys did when they were healthy. Hemodialysis helps control blood pressure and balance important minerals, such as potassium, sodium, and calcium in your blood. Hemodialysis can help you feel better and live longer, but is not a cure for kidney failure.
Hemodialysis is a medical procedure. It's one of the ways you can treat severe kidney disease. The way hemodialysis works is that it uses an artificial kidney to replace some of the functions of a healthy kidney.
Blood is taken out of the body, goes through the dialysis machine, goes through the filter, is cleaned, and then it comes back into the person. So you don't really lose any blood. It all goes through the dialysis machine, gets cleaned, and then comes back into the body.
So it's really that artificial kidney and the blood working together to clean the fluid in my body. You're taking that urea out of the blood, you're taking potassium out, or the different things you want to balance out of the blood, so then it's like a magnet, and it'll draw those solutes out. It's an amazing process when you think it has to get to the cells all through your body, from your toes to your head. Each one of those cells has fluid in it that needs to be cleaned. Everything you normally would get rid of through urination, you're trying to get rid of through the hemodialysis.
And when people dialyze, sometimes if they do conventional dialysis where they're dialyzing 3 times a week, they may feel sort of tired after they have dialysis, but then after a while they feel better. People who do more intensive dialysis or daily dialysis at home, they feel like they can do things right away.
It isn't that you're living to dialyze. You're going to dialyze so you can go out and live the life you were meant to live.
Application in medicine. A 88-year-old man with a history of end-stage renal disease who had undergone thyroidectomy present to emergency department with weakened and diffuse muscle, each of missing a hemodialysis session. The laboratory analysis showed severe hyperkalemia. The patients underwent emergency hemodialysis, which resulted in a marked improvement in the electrolyte balance.
You need your kidneys to live. It's obviously very important. Unfortunately, some people lose their kidney function. It's either due to chronic illnesses. The most common form of chronic kidney disease in America is diabetic kidney disease. In addition to that, people lose their kidney function acutely, suddenly, due to a catastrophic illness or some intermittent reversible illness. When that happens, people need acute dialysis as a life-saving treatment to allow them to have a reversal of their acute medical problems and survive. The dialysis is typically done either in the intensive care unit or here in the inpatient dialysis clinic at Piedmont Hospital. Often dialysis is a bridge to transplantation, and people on dialysis are often on the kidney transplant waiting list, and hopefully at one point in the future will get a kidney transplant either from a family member or a loved one, or alternatively through the deceased donor kidney waiting list. Dialysis is done typically in two different ways. The most common way it's done is a treatment called hemodialysis. Hemo refers to blood, so in this treatment blood is removed from the body, treated through a dialysis kidney filter, and then returned back to the body. People on this treatment can have a normal daily lifestyle. They are able to participate in their normal daily family activities. A lot of people on this treatment can go to work on a regular basis and are able to have a good quality of life. The second form of dialysis is called peritoneal dialysis. So peritoneal dialysis that allows people to do the dialysis treatments in their own home. Treatment involves using your own body, using the peritoneal cavity to do the dialysis. Fluid in the peritoneal membrane can be exchanged to remove kidney poisons and extra fluid, and therefore allows the individual to replace their kidney function and restores them to good health and normal daily activities.
Pros and cons. Pros. The patient improved his potassium levels, calcium levels, sodium and vitamin D levels by performing an emergency hemodialysis. Also, the T-waves on the electrocardiogram, although the QT segments remain prolonged. Cons. Hyperkalemia causes a QT or T abnormal waves in the electrocardiogram. It can cause palpitation, muscle pain, muscular weakness, or numbness. Mice hemodialysis causes abnormal electrolyte levels. Mice hemodialysis can lead to a patient death. Application in Ecuador. Patients with renal disease and insufficiency have a life expectancy of 5 and 20 years in Ecuador. Conclusion. In conclusion, hemodialysis in renal patients can improve hyperkalemia and or other electrolyte abnormal range. However, a mice hemodialysis can lead to elevated QT or T with muscle H and other electrolyte abnormalities. That's which is important to have control in hemodialysis treatment. Thank you.